On this edition of Veterans Health Watch, we'll learn how the VA Maryland healthcare system is helping veterans to maintain a healthy lifestyle.
We'll also learn how recreation therapy and kinesiotherapy enhances veterans' health, functional abilities, independence, and quality of life.
Welcome to Veterans Health Watch, a program sponsored by the Veterans Affairs Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm your host, David Edwards, and today we're here at the Loch Raven VA Community Living and Rehabilitation Center.
And I'm Andrea McCoy. Today's show, we're going to focus on the benefits of maintaining a healthy and active lifestyle. And helping us get started on the discussion of how to maintain a healthy and active lifestyle through proper nutrition and physical exercise is VA dietitian and coordinator of the VA Maryland Healthcare System's MOVE program, Kevin Grotnitsky. Welcome, Kevin.
Good morning, how are you?
I'm great, thank you. Kevin, there is so much information available to us about weight management. What guidance do you give to veterans who want to lose weight and maintain a healthy lifestyle?
Great question. I think first, avoiding fad diets. I mean, many people are looking to lose weight during parts of the year, and the question is, can you maintain those changes throughout the year? I had a family member a few years back wanting to lose some weight, went on what they call the grapefruit diet, was singing the praises of the grapefruit diet, lost, I think, 25 or 30 pounds. The question is, how long can you stay on the grapefruit diet? Once he went off the diet, he wound up regaining the weight and then some. So, I basically tell patients, veterans, etc., if you're going on a particular program, are they changes that you can continue to stick with potentially throughout the rest of your life?
And Kevin, sometimes starting that commitment to a weight loss program can be the hardest first part of the challenge. How do you encourage veterans you work with to make that first step in losing weight and taking on a healthier lifestyle?
Again, long-term approach, radical change is temporary, incremental change is more permanent. So with that mindset, I know myself when I went from a junk food junkie to trying to eat a healthier lifestyle, I was looking, first of all, it wasn't a diet. I was having fun with making new changes, and I wasn't looking to make all those changes right away. One step at a time, one new change at a time. And again, there were periods in my life I tried diets. They're designed for maybe one person or a few people, not for everyone. So you kind of have to look at yourself, look at your likes and dislikes, and pick changes that you can stick with and that are simple and doable for you.
Kevin, I know that many of us eat in response to our emotions, such as sadness, boredom, or anger. What strategies do you suggest to veterans in order to change these behaviors to manage their weight?
Well, I think first, if a veteran is having an issue or issues that they feel that they could use more support with, I would always encourage our veterans to seek out mental health support from a qualified licensed professional here at the VA or outside to check in with them, to help them. Other strategies, there's a term called mindful eating. It's a practice of intuitive eating, so to speak, where many of us are eating in distracted ways. One moment we're feeling stressed, the next moment we have hunger cravings. So mindful eating asks you to kind of take a step back, slow down a little bit, really honor your hunger. So think about at that moment, are you hungry? And even kind of check in throughout that meal. So are you speed eating, distracted while you're eating, emotionally eating at that moment? Or can you set a goal to maybe slow down 10%? Check in at some time during the meal to see how hungry or full you are. So mindful eating, although it takes some practice and there's more education involved, is an approach that may help with that.
And Kevin, what are some of the other factors that can lead to overeating?
So certainly you have genetic causes, you may have environmental, and to touch on environmental, I ask a patient to take a look at their home environment and their work environment. Are you setting yourself up for success, or are you setting yourself up for many challenges? You know, if I have cake set on my counter, you know, I may be able to resist the cake 1 or 2 times, but eventually I'm going to have some cake. Now, certainly all of us can enjoy our favorite foods from time to time, but you know, we've had other patients who are keeping on their bedside counter cookies, potato chips, etc., very easily accessible. So we want to restructure the home environment, work environment. I want to have fresh fruits and veggies, healthy, tasty snacks that are satisfying at my disposal and ready. And I want to have more of the junk food, more tucked away, so to speak. Doesn't mean I can't have it on occasion, but it's not as readily accessible. So check your home environment and see if you need to do some restructuring.
Kevin, we're now entering the winter months with shorter days. We can be tempted to hibernate and not be so active. And then now we have the holidays coming where we all want to overindulge. In addition to what you've already suggested, how can veterans stay focused during the winter months to maintain their weight?
Well, I see, it's a great question. I see that a lot with our veterans. You know, they tend to feel healthier, they're more active during the summer months, spring, early fall, and in the winter months, there are challenges finding ways to become more active. It's colder, like you said, the days are shorter. So, you know, I like to ask a few questions to veterans. You know, how do you feel when you're moving more? You know, does it affect your mood, your health, your energy, your sleep? And I like to look at exercise as something non-negotiable. I encourage veterans 12 months out of the year to think about how can I maintain my level of activity throughout the year, rain, sleet, shine, snow, etc. So we want to develop strategies for the winter months, for the colder months, even in the summer when it's really hot. So we're going to discuss options throughout the year, whether it's mall walking, YMCA, local community resources. We give DVDs out for exercise for home use as well. So not can you stay or will you stay active during the winter months, it's how will you stay and what strategies can you put in place so you feel good and you're active all year round. That can actually help with managing our weight and actually helping us feel better overall.
Kevin, all the tips that you're talking about today are things that you discuss with veterans as part of the VA's Move Weight Loss program. I'm sure there's members of our viewing audience out there who would like to know who exactly is eligible for this weight loss program and how are veterans referred to this unique program?
So veterans 18 years or older are eligible if they're considered overweight. So body mass index of 25 or greater. How do you know what your body mass index is? You can check next time you see your healthcare provider. It's right in your medical record. You can ask them what it is. How do you sign up? You can check with your local center. It's going to be a little bit different at each center. You can also call our call center, 410-605-7333. We also have an 800 number as well. We also have Telemove, and Telemove is a version of Move which is best for working veterans or veterans who really can't make it to our group program here at the VA. They would need a consult from their primary care provider. Regular Move, no consult necessary, they can self-refer, or Telemove, you'll need a consult from your primary care.
Very good.
If a veteran wanted to meet with a VA dietitian to discuss a healthier diet, what do they need to do?
So again, they could check with their local healthcare team, primary care provider, get a consult, or they could call the call center to schedule an appointment as well. And that's again 410-605-7333, or we also have an 800 number as well.
Kevin, thank you so much for joining us today. I really think the members of our viewing audience learned some wonderful tips as we head into the winter months this year.
Great. Thanks so much, Dave and Andrew.
Thank you.
We're going to take a short break, but when we return, we'll learn how VA recreation therapists help veterans maximize their leisure time to have an active lifestyle. So stay tuned.
Did you know that Department of Veterans Affairs provides physical and mental health care for over 8 million veterans? Hi, I'm Natalie Dell. I may be an Olympic medal winner, but I know that real champions are those who have served this country, and VA knows that too. As a VA employee, I've seen the challenges our veterans face. I'm honored to be part of a team that supports veterans in achieving fuller, richer lives, and I invite you to join us in this rewarding experience. If you're a mental health provider, I urge you to visit vacareers.va.gov.
Those veterans who don't enroll in care, many times if you ask them if they're a vet, they'll say no, but I did serve in the military.
Anyone that made that commitment to put your life on the line for others is a veteran.
The system is very accessible. For instance, enrollment. We have 3 ways to enroll.
You can enroll online, you can physically go into the VA and enroll, or you can telephone to enroll.
Doesn't cost anything to enroll. All it takes is a few minutes of your time and a copy of your DD-214. That's all you need.
I'm a veteran myself, and I tell the family, when you entrust the care of your loved one to me, you can go home safe and very at ease.
Best thing that you can do is just come in and apply.
Without a doubt, any veteran definitely owes it to themselves to enroll. You know, your health and well-being is priceless.
Welcome back to Veterans Health Watch. Joining us now to talk about the VA Maryland Healthcare System's Recreation Therapy Program is Charmaine Johnson, the Chief of Recreation Therapy at the Perry Point VA Medical Center. Charmaine, thank you for joining us today.
Thank you for having me.
Charmaine, why don't you get our audience started by giving an overview of what is recreation therapy and how is it beneficial to veterans to help them keep a healthy and active lifestyle?
Well, first of all, the VA is the largest employer for recreation therapy. And recreation therapy is an actual rehab treatment services, and we utilize leisure and recreational opportunities to help veterans stay active. For those with different disabling conditions, we try to help them to maintain their independence as much as possible. And we also try to help increase their quality of life by having them still do things that's meaningful to them.
Charmaine, how do VA recreational therapists respond to the rehabilitative needs of both older generations of veterans and those just now returning from Iraq and Afghanistan?
Well, the recreation therapists are in different areas of the VA. For instance, we have recreation therapists in our community living centers, and in our community living centers we have a lot of older geriatric populations. So pretty much for them, it's maintaining their quality of life if they are actually living in the community living center. We want to make sure that whatever life was like at home, we want to continue that while they're staying there. For those that are in the community as outpatients, as far as geriatrics or the older veteran, we try to do different things within the community. For example, getting some of our older veterans that are 50 and older, not saying that 50 years is old, but we partner with the Maryland Senior Olympics to have veterans get active with that. For those that's returning, our OIF, OEF veterans, also wanting the veteran to be active in the community, to not always have to come to the hospital for treatment. So we partner with different community resources to show that they can do things within the community as far as recreation, and also to have their family involved in different recreational opportunities along with them.
Charmaine, how does a veteran go about getting referred for a certain recreation therapist?
Well, if they're an inpatient, a provider, whether it's if they're going to see a psychiatrist or their social worker or their primary physician, can refer them for recreation therapy. If they're outpatient, the same. Any provider within the VA can suggest or put in a consult for recreation therapy. It's pretty much getting the word out to other disciplines of what recreation therapy can offer, so they can get the word out to the veteran, whether they're an inpatient or outpatient, to receive those services.
So it is available to outpatients as well?
It's available to outpatients. The recreation therapists in the VAMIS, we don't have any that's assigned to outpatients, but we have other programs that outpatients can take part in, which is some of our national rehab programs.
Charmaine, what types of recreational activities are available through the VA Maryland Healthcare System for our hospitalized veterans?
We have a ton of recreational interventions that our inpatients can take part in, anywhere from equine therapy with some of the local therapeutic horseback riding farms, kayaking with Team River Runner, aquatic therapy, bocce, fishing with Healing Waters, archery. We've teamed up with a lot of community partners to be able to provide a lot of resources for inpatients as well.
And Charmaine, you mentioned in your last answer about the national games, and I understand we have a number of veterans throughout the VA Maryland healthcare system that have competed in the national games, and that this is an avenue for some of our outpatients, as you said, to get involved in diversional recreation activities to help them maintain an active lifestyle. Can you tell us a little bit more about the national games and how they benefit veteran patients?
The VA has 6 national rehab events that they offer each year. The first one is the National Creative Arts Festival. It is open to any veteran. It's held nationally and it rotates from city to city. For instance, this year was in Reno, Nevada. To be a part of the National Creative Arts Festival, we have a local creative arts festival here within the VA Maryland healthcare system where any veteran that's enrolled within the VAMICS can participate in this local creative arts festival. And it consists of 2 categories, either visual arts or performing arts. So our local creative arts festival will be held in February of next year. And once you place first locally, you're sent to the national committee to be judged nationally. And hopefully you'll have a chance to attend the national competition, which will be in Milwaukee, Wisconsin next year. The second rehab event is the National Golden Age Games. It's for veterans that's 55 and older. They're trying to change the age to 50 years and older. It has like different categories that veterans can compete in as far as different sports, and it's actually a competition. We have the National Summer Sports and Winter Sports Clinics, and they are actually clinics where veterans can go and learn about adaptive equipment as far as summer type activities, winter activities where they have skiing, and they usually have veterans with like spinal cord injuries, amputees, PTSD, so each of the national events do have certain diagnoses that they may be targeting more. We have the National Golf Tee Tournament, and we also, I think I covered them all.
Yeah, these sound like wonderful therapeutic activities.
They are.
If a veteran was interested, how do they get involved in these national activity events?
Well, first of all, the veteran definitely has to be enrolled within the VA Maryland healthcare system, and they can go to their primary provider or, once again, like I had mentioned earlier, any other provider to put in a consult for them to be a part of these programs.
And is there a number they can call as well if they want to get more information about the games?
Yes, actually they can contact me at 410-642-2411 extension 2909, and then I can put them in contact with our various point of contacts for each national event.
Very good. Now, Charmaine, how does the VA help veterans who are selected to go to any of the national games with expenses and equipment and training?
Well, first of all, with these being national rehab events, the focus is on rehab, so it's definitely like not a vacation for the veterans. They work hard. We provide clinics throughout the year so they can actually practice, because like I mentioned earlier, the Golden Age Games and the VA Wheelchair Games are actually competitions, so we want our veterans to be competitive with other veterans across the country, where they can learn the different techniques or whatever they're competing in ahead of time. So if we have returning veterans that are very interested, they take competing very seriously, and the VA actually does help them with getting equipment that they need to go out and actually be competitive.
Outstanding. Charmaine, thank you so much for joining us today. Having been to many of the national games, I can vouch for how meaningful and productive they are for our veteran patients. So thank you for joining us today.
Thank you for having me.
We're going to take a short break now, but when we return, Andrew will be talking with some of our kinesiotherapy staff to learn how strength training can help veterans maintain an active lifestyle. So stay tuned.
The best thing about long-term care is that we look at our residents, we don't call them patients, they're residents. They don't live in our facility, we work in their home. So the environment, it's a home-like environment. We look at them for what makes them special. What are their preferences? What are their uniqueness?
I am very happy and secure to know that he's somewhere where he's being cared forth. I know that he's safe. They're never just sitting idle. They do have trips.
They understand different things about them, and they'll explain it to us.
Other than a community living center, we provide rehabilitation services and post-acute services. So not everybody is a nursing home resident, so they may be called patients. We all work together to make sure that we plan and provide the compassionate, safe environment for our veterans.
A lot of women veterans don't realize that the VA is here to take care of them. They served and they deserve the best health care that there is. The Women Veterans Program has been redesigned to meet the needs of the women veterans.
Female veterans receive just as good a care as men because they're focused more on us now.
We want them to come here, we want them to feel welcomed, and we want them to know that we are capable and willing to take care of them.
Welcome back to Veterans Health Watch. I'm Andrea McCoy, and joining me in the kinesiotherapy clinic here at the Loch Raven VA Community Living and Rehabilitation Center is VA kinesiotherapist Sharon Taylor Johnson. And joining us also is U.S. Army veteran Ralph Cummings. Thank you both for joining us today.
Thank you for having me.
Sharon, what is kinesiotherapy and where is it offered throughout the VA Maryland healthcare system?
Kinesiotherapy is the study of human body movement. It is a design exercise program that is put into practice to accommodate the rehabilitative need of a patient who has a physical disorder, including injuries or diseases, and is offered in the VA setting, Loch Raven facility, and also Perry Point.
As a kinesiotherapist, how do you determine the rehabilitative needs of veterans who come to your clinic?
Well, first I evaluate and assess the history of inpatient and outpatient. I design an exercise program for the individual to work on their strength and conditioning and to improve endurance and to maintain functional ability and to retain mobility.
So I know that veterans have to be referred to the kinesiotherapy clinic by their VA primary care physician. Can they self-refer? And how long is their stay in the clinic? How do you determine how long their stay in the clinic is?
No, unfortunately, they cannot self-refer themselves to kinesiotherapy. They have to be referred by a primary care physician. And the length of stay for inpatients is normally 2 to 4 weeks. Outpatients are normally 4 to 6 weeks, all depending on the progress of the individual.
Sharon, in a previous segment, we talked about veterans' participation in national rehabilitative games and events. What role do kinesiotherapists play in preparing them for these games?
Well, Andrea, we help prepare our veterans in preparing the National Golden Age Games with selecting sports that they would like to compete in, and each veteran should be of age of 55 years or older. And the sports that they are participating in, they must be willing to compete and be competitive with other veterans who are participating in these games.
Mr. Cummings, welcome again. Can you tell us what led you to seek your healthcare needs with the VA Maryland healthcare system?
Yes, I am a recovering head injury patient. I was wounded in Vietnam and I was paralyzed, and I recovered through the help of the exercising program that I have been participating here at Loch Raven VA and other facilities. And it is very important to me to continue programs like this.
Tell us, how did you get referred to the kinesiotherapy clinic?
My primary care doctors referred me to the clinics and the training programs.
How has being a part of the kinesiotherapy program helped you to regain your functions of day-to-day living?
My day-to-day living was a nightmare. As a paraplegic, being paralyzed, I'm ex-veteran activities that I had, exercising in the veteran programs. I did bowling, I had other activities that I participated, but as laying there as a paraplegic, all I could do is dream. And once I was introduced to this program, it allowed me a freedom of myself. And now, as you see me standing here, it's a result of me becoming a participant in this program.
I understand that you've recently been involved in the VA Golden Age Games. Congratulations.
Thank you very much.
How was that experience for you?
I have met so many veterans across the country, had so many stories to tell. They uplifted me, and I felt alive again, participating. I had more energy. I left with more energy than I ever thought I would have. And I look forward to passing this on to other veterans, because this is a worthy program to be involved in.
I see that you're wearing some medals today. Where did you attain these medals from?
My first medal I obtained in Colorado in the winter sports. The second one was in San Diego in the summer sports. And my third one I received in the National Senior Olympics.
Congratulations, great job.
Thank you very much.
Mr. Cummings, thank you so much for sharing your story with us today.
You're welcome.
In closing, Sharon, is there anything else you would like to add on how kinesiotherapy or participation in the VA Golden Age Games can help to enhance a veteran's healthy lifestyle?
Yes, just always remember that you can maintain a healthy lifestyle at any age. Always to remember to exercise and to continue to do whatever you want in your life in order to be physically fit.
Thank you, Sharon, for sharing with us on how kinesiotherapy can help enhance veterans' activity levels. That wraps up this edition of Veterans Health Watch. If you have a question about today's show or suggestion for future topics, please call us at 1-800-463-6295, extension 7101, or visit our website at www.maryland.va.gov. You can also join us on Facebook and Twitter. If you are a veteran or know a veteran who is not enrolled for VA healthcare, please call 1-800-463-6295, extension 7324. Visit your local VA medical center or visit us online. We look forward to hearing from you. Please join us next time.
I was homeless with a bag of clothes over 2 years ago.
We have outreach workers, licensed social workers that go out into the community and they provide assessment, referral, case management services to our homeless veterans. We provide almost anything that the veteran needs in order to try and get him back off the street and back into society.
And I call my mom every day and she hears it in my voice. She says, "You're alive now and you're living." These people, from a nurse to the guy mopping the floors, they all have one thing in common. They save our lives. I work my incentive therapy program, working in the mailroom. I feel like I am somebody now. It's hard for me to ask for help sometimes, taking the buses around there, and I see these homeless vets. And there's help. There's always help.
The VA Maryland healthcare system is a great system.
It's not your grandfather's VA.
We are a progressive and dynamic healthcare system.
And it's our mission to provide the highest quality healthcare to our veteran heroes.
Great programs, great technology, great staff.
And it's just touching to see how everybody just come together as one.
We do what we can to see that they get the best service.
It's a family. Nobody takes better care of you than family.